Mathieu Bremont. He is a physician, physiotherapist in English in France, and me, I am a family practitioner in France. We come from Tours, in the center of France, and our research team is EES, Education, Ethics, and Health. And this study is a phenomenological analysis about COPD patient. So to remember the epidemiology of the COPD, there is 3 million people died in 2012, and with a very important social cost, around 3.5 billion euro in France last year. So the global burden of COPD represents the fourth leading cause of death in the world, and it's one of the public health priority topics. The evolution of COPD is slow and insidious. Patient presents a spiral of physical and psychosocial deconditioning and have a poor quality of life. One qualitative study showed that patients develop strategy of coping and denial with an acceptance for COPD. The spirometry is a technical act necessary for the diagnosis of COPD, and it requires involvement and the effort for the patient. So our objective was to determine if a first spirometry performed in the primary care setting is associated with increased awareness patients of their symptoms and their state of respiratory health. So we perform a qualitative research. We included some patients after had been diagnosed with a smoking-related COPD by spirometry conducted by their own family physician. In several settings in our department last year. We performed elicitation interview. It's a method of open, non-inductive interview, which allows to explore the experiences. It's not a typical interview because we are not face-to-face with the patient, but side by side. And we speak very slowly to allow the patient to relive his experiences of the spirometry. The reference event is the spirometry. We describe our results by 3 times: T1 before the examination, T2 at the time of spirometry, and T3 at the announcement of results. And we choose a phenomenological approach to analyze relived experiences of spirometry, and triangulation and iterative analysis was respected.
So I present you the results. So we gathered 10 patients together, and we interviewed them for an average of 30 minutes, as recommended in most API. Sometimes it lasts longer, but for this one, as we explore the main feelings and emotion that occurs during the spirometry, it lasts shorter. So in the first time, the first period before the spirometry, there was different themes that were recalled by the patient. Most of them were about apprehension. Some patient was telling, we know, but we don't want to know. We have strong doubts. They evoke also an unknown experiences for the spirometry. Still, see what happens. So here we go. Let's go. Lots of phrase around apprehension and stress and anxiety of performance. They wanted to compare themselves to the spirometer, and they were saying from time to time, well, I'm not starting to stress, but I'm not going to be sick too much. In the second part, during the spirometry itself, Patients were calling about strategy of appropriation. They were telling the spirometer, naming the spirometer as an object, as a toy. Some says, I call it a toy, a trumpet. It was an uncomfortable experience for most of them. It makes cough like an animal, and it brings the emotion, a sort of conscience of their state of health. They start to understand, as they felt in their body, the limitation of their breath. Then the third time after the spirometry, they were recalling a stage of mourning as described by Kubler and Ross. And just to name a few, but there was lots more to say, they were in shock. I tell myself it was not good news. Sometimes they were about denial. I take this for a joke. Pain and depression were eliciting. It is like a sentence of the condemned. Or so more positive thoughts as rebuilding. Now I look to the future. So we after using this chronological sentence, and we eliciting into the work different theme as the spirometry could create the right combination of the health behavioral change model. One of the three pillars of changing behavior is the importance. As the spirometry brings up the limitation of their symptoms, the patient are aware of their disease that occur very slowly during times to times, as it was said before. Moreover, the spirometry time with the GP is a good opportunity as it brings settings of self-confidence and support, and patient perception bring out to the conscience. And spirometry testing may be an optimal time to make behavioral change. Moreover, with their GPs, they can build their confidence in their capacity of changing their behavior. Lots of them evoke opportunity to start reducing smoking or just quit smoking. So importance, opportunity, and confidence, the three pillars for behavioral change in most of the models. The perspective of these studies, it was to stretch out that just a technical act that as spirometry could be a good opportunity for the GPs to actually explore more appropriation of the disease. But more studies we need to do more studies to actually express the effectiveness of this change of behavior. Moreover, the tool we use, eliciting interview, could be useful tools not only to assess the thoughts of the patient during the spirometry, but also to bring the conscience of their chronic disease on a more long period. Probably other technical gestures, just as spirometry in primary care, could be equally a good opportunity and a good ground for research to promote self-confidence in patients with chronic disease. So we need more other phenomenological studies based on technical acts in primary care to enhance this perspective. Well, that was all, and thank you for your attention, and we're open to questions.